Okay, so for this assessment this evening, I'm going to be explaining what I would do when I am assessing the genital area of either a female or a male. So let's begin with the female. So for the female, of course, I would enter the room and provide patient privacy, first and foremost, and then I'll perform hand hygiene. I would introduce myself and make sure that I identify the patient with at least 2 identifiers, which is usually their name, and their date of birth. And then I would explain the procedure and tell the patient what it is that I'd be doing. So first, I would get a history. I would ask her if she has any vaginal discharge, if she has any pain, swollen area, if it's swollen down there or inflamed, or if she has any lesions. I would also ask if she has any history of any genital urinary conditions, or which include dysuria, nocturia, and incontinence. Or I would ask her if she has any bleeding. I would also ask her if she's taken the HPV virus vaccine. And I would also ask her if she's had any history of HPV or any STIs of any kind. And then I would perform the assessment. I would make sure that the female would be in the dorsal recumbent position with her arms to the side. Make sure that there's a flat sheet draped over her legs to provide privacy. I would examine the external labia, make sure that there aren't any lesions, any bumps, any abnormalities of any kind, and then I would examine the inner labia, the labia minor. And then, of course, I would let her know the risk that she would have if she's sexually active with STIs, and of course the risks of cervical cancer and ovarian cancer as well. After that, I would let her know if she was at risk for anything, and then I would, of course, continuously provide privacy for her. And then I would, of course, but before all that, I would before I even checked her, I would ask her if she needed to go to the restroom. And then, of course, I would I would cover her up, and then I would be done with her examination. Then I would go to a male patient. A male patient, I would, of course, provide patient privacy and, of course, perform hand hygiene. I would, he would be exposed, but of course, I would provide him as much privacy as I could. And I would, first, I would inspect his perineal area, and I would inspect the shaft and the penis, and I would make sure that there were no abnormalities, any lesions, any growths of any kind. I would make sure that there wasn't any swelling or inflammation. I would also tell him if he was sexually active, his risk for STIs, and I would also tell him if he was at risk for prostate cancer as well, or testicular cancer. I would inspect the corona, the prepuce, the glands, and the urethral meatus. And then I would retract his foreskin if he wasn't circumcised. And I would make sure there was no lesions there or if he had any edema. And then I would inspect the size, color, and shape and symmetry of his penis and his testicles to make sure that everything is well. After that, of course, like I said before I would do that, I would make sure that if he needed to go to the restroom, he would be able to go. And then I would be done with the procedure.